Shawn Ryan sat down with Dr. Gabrielle Lyon to discuss a range of topics, from cancer screening to nicotine, hormone replacement therapy, and longevity. The conversation shifted with Shawn expressing his fear of getting a cancer diagnosis, but Dr. Lyon reassured him that there are robust screening tools available, such as full-body MRE scans and the Grail test, which can detect early signs of cancer. She emphasized the importance of early detection, citing the example of colon cancer, which can be treated if caught early. Dr. Lyon also shared her own experience with annual screenings and encouraged Shawn to do the same.
The conversation then turned to the topic of cancer prevention, with Dr. Lyon stressing the importance of diet and lifestyle. She mentioned that obesity is a significant risk factor for cancer, and that a healthy diet and regular exercise can help mitigate this risk.
Shawn asked about the role of sugar in cancer development, and Dr. Lyon explained that while sugar is not a direct cause of cancer, it can contribute to an increased risk. The discussion then shifted to the topic of nicotine and its impact on health.
Dr. Lyon emphasized that quitting smoking or vaping can significantly reduce the risk of cancer, and that it's never too late to make a change.
Shawn asked about the effectiveness of blood tests in detecting cancer, and Dr. Lyon explained that while they can be useful, they're not foolproof and should be used in conjunction with other screening methods. The conversation then turned to the topic of longevity and aging.
Dr. Lyon shared her expertise on muscle-centric medicine and the importance of maintaining muscle mass as we age. She emphasized that this is key to preventing diseases like obesity, heart disease, and diabetes. Dr. Lyon also discussed the importance of stem cell treatments in repairing and rebuilding damaged tissue. She explained that while these treatments are available in the US, it's essential to choose a reputable provider to avoid any adverse effects. Dr. Lyon emphasized that it's never too late to make a change, and that small steps can add up to make a significant difference in overall health and well-being. She also discussed the importance of finding a reliable resource, such as a board-certified physician, to provide accurate information and guidance. The conversation then turned to the topic of functional medicine, with Dr. Lyon explaining that it's a way of thinking about healthcare through the lens of root cause medicine. She emphasized the importance of addressing the underlying issues rather than just treating the symptoms. Dr. Lyon also discussed the importance of comprehensive testing and treatment, and noted that many of the issues she encounters in her work can be easily treated with the right approach.
Shawn asked about the role of nicotine in improving cognitive function, and Dr. Lyon explained that while nicotine can have some benefits, it's highly addictive and should be used discretionally. The conversation then turned to hormone replacement therapy, with Shawn asking about normal testosterone levels.
Dr. Lyon explained that hormone replacement therapy has a taboo film around it, and that testosterone is not FDA approved for women, but she puts women on testosterone all the time for off-label use.
The discussion continued with Shawn asking if the population as a whole has lower testosterone than their grandparents did.
Dr. Lyon confirmed that it is, and attributed it to environmental factors, obesity, and sleep habits. She also mentioned that fertility levels have decreased, and that people are not as robust as humans as they used to be. The conversation then turned to the idea that testosterone replacement therapy causes prostate cancer, which Dr. Lyon debunked. She explained that it's not true, and that in fact, low testosterone can have negative effects on prostate cancer. She also mentioned that testosterone replacement therapy does not increase the risk of heart attack, citing the Traverse trial.
Shawn asked if it's possible to maintain the same level of testosterone throughout one's life, and Dr. Lyon believed that it is possible for men. She shared an example of her 74-year-old father, who lives in Ecuador and has a testosterone level of 750. She mentioned that nutrition science is relatively new, and that the guidelines for nutrition haven't changed in the last 50 years. The conversation then turned to the topic of longevity, with Shawn asking about the blue zones.
Dr. Lyon pointed out that the blue zones have some of the highest poverty rates, smoking rates, and the lowest levels of education and income. She argued that it's not just about picking areas with high longevity rates, but rather about the culmination of how one lives their life. Dr. Lyon emphasized that to live to 100, one needs to be strong, have muscle mass, and prioritize resistance training. She believes that the problem with obesity is not just about the number on the scale, but rather about unhealthy skeletal muscle. She also emphasized the importance of body composition and noted that walking alone is not enough to achieve this.
The conversation then turned to the topic of supplements, with Shawn asking about the benefits of certain supplements.
Dr. Lyon believes that while whole foods are ideal, they may not be enough. She uses greens and red powders, rich in phytonutrients and colors.
Shawn mentioned that he's coming out with a supplement that includes cordyceps and lion's mane mushroom extract, which he believes will be convenient and easy to use.
Dr. Lyon agreed that convenience is key and suggested putting the eyedropper of mushroom extract in protein powder.
Shawn's goal is to create a supplement that is easy to use and doesn't require a lot of time or effort. She adds an extra scoop of collagen and takes a small scoop of colostrum, which is great for gut health. She also takes a protein shake, fish oil, magnesium, and zinc. She's a big fan of urolithin a postbiotic that's good for mitochondrial function, and takes 1,000 milligrams of it. The conversation then turned to the topic of sleep, with Shawn asking about the importance of sleep for overall health.
Dr. Lyon admitted that she's not great at sleep, but thinks it's essential for overall health. She believes that the longevity space often tries to avoid talking about the inevitable, which is death, but thinks that it's a natural part of life. She's fascinated by the idea of near-death experiences and the possibility of an afterlife. The conversation then turned to the topic of psychedelics and their potential benefits for Alzheimer's and dementia. Dr. Lyon shared that while there's promising information, more research is needed to confirm the benefits. She also shared her personal experience with ayahuasca, which she tried in Ecuador, and how it has helped some of her patients. The conversation then turned to the topic of neutrality and how it can contribute to success in life. Dr. Lyon shared a personal story about a patient who would host a big event in Vegas every year, only to feel depressed and unmotivated afterwards. She notes that this pattern is predictable and can be managed by training ourselves to modulate our dopamine levels. The conversation then turned to the topic of successful people and their attributes. Dr. Lyon emphasized the importance of setting standards rather than goals, as standards allow for a sense of identity and purpose. She also highlighted the need to manage distractions, which can be a major obstacle to achieving our goals. Dr. Lyon shared a harrowing story about her 3-year-old son almost drowning in a pool due to the distraction of the lifeguards, who were all on their phone. This experience drove home the importance of staying focused and present in the moment. The discussion turned to the concept of discernment, which is the ability to distinguish between what's important and what's not. Dr. Lyon argued that discernment is a critical skill for achieving success in all areas of life, from health and wellness to business. She emphasized the need to be mindful of our thoughts and actions and to prioritize what's truly important. As the conversation came to a close, Dr. Gabrielle Lyon shared some exciting news about her upcoming books, including a manual that will provide a protocol-based approach to health and wellness, and a book specifically for women.
Shawn Ryan thanked Dr. Gabrielle Lyon for her time and insights, and encouraged listeners to share the episode and leave a review on Apple and Spotify podcasts. To access the complete 24-minute summary and unlock detailed insights for each topic discussed in the video, please subscribe to Quick Podcast Summaries on Spotify and Apple Podcasts with free trial and later, just for the price of candy in most places. Happy listening.